what actually is a GLP-1?
So a GLP-1 is a peptide that's made in a lab that's supposed to mimic an actual hormone that's in your body. Okay. That they discovered this peptide when they were doing gastric bypass surgery on patients that were diabetic. So they were fasting for 12 hours for the surgery. And then all of a sudden, right after the surgery, within like an hour, their blood sugar was dropping significantly, right? Which didn't really make sense because they'd been fasting for 12 hours. So, with further research, they found out this little hormone, this peptide, was causing your body to increase the insulin produced by the pancreas just slightly, and also increasing your body's response to the insulin. So, your cells accept more insulin. Okay. So, diabetes type 2, which is typically called acquired diabetes, it's where your body makes plenty of insulin, but it can't get insulin to the cell. The cell doesn't want to accept it, right? That's called insulin resistance.
Mhm.
So that insulin resistance causes your body to circulate all that extra sugar you're taking in, and it just circulates around into the blood until finally it's deposited into fat cells, right? So it's stored for later use, or it continues to circulate and causes issues with your other organs. So it was originally designed for diabetics, but what they found was that when they started this study, that all these diabetics that started taking this medication, they started losing weight. Okay,
Mhm.
so they were like, "What is going on here?" Well, their calorie intake decreased when they took this medication because there's a hormone in your stomach called ghrelin that's responsible for hunger. So it also inhibited that hunger hormone. So this medication is dose dependent, right?
Mhm.
So the lower the dose you take, the less of the appetite suppression you're going to notice.
Mhm.
Most people take 5 units, you're not going to have any appetite suppression at all. You probably won't feel like you're taking anything. Okay.
Right.
But, the term microdosing that we were talking about,
Mhm.
you don't have to have the appetite suppression from semaglutide to still get some of the effects from the semaglutide, because once you inject it in your body, it's still working, even though it may not be enough to suppress your appetite, right?
Right.
But studies are showing that it's improved mental clarity. It helps decrease the amount of plaque in your brain. So, like, they're currently using um, studies in Alzheimer's patients to try to reverse some of those symptoms related to plaque in the neurons.
Mhm.
And then the big thing is the inflammation. So,
Mhm.
your these things called cytokines, right? Is your body's inflammation response to things in your body. And normally they're foreign objects that they're attacking. But
Mhm.
in autoimmune instances, your body uses those fighters to attack itself. It gets confused. So this decrease in those cytokine response decreases inflammation. So people that have gut issues have noticed, wow, that's actually, I'm not having those same symptoms. I'm not producing as much mucus. I'm not having as many stomach cramp episodes. Um, and again, totally didn't expect it, but that's one of the side effects of the semaglutide. So it's one of
Mm.
the things that's why, if you don't need the appetite suppression, if you don't need weight loss, they're
Mhm.
up for the semaglutide, right? So that mental clarity, neuroprotective aspect of it, and also the anti-inflammatory. So anybody that has any kind of autoimmune issue, definitely something you want to consider, even if you don't want to.
Right. Now, to piggyback on that, so you were talking about, so like if they didn't want, if they're for the weight loss and stuff like that, but and to decrease their appetite, they don't want to decrease their appetite. But let's say that someone like myself, who we've been microdosing with, starting a really small, I don't have any decrease in appetite, but I didn't have those, that wasn't my issue, which I know a lot of women out there, that's not their issue. Like they really are trying to actually get more calories in because they're not eating enough, getting that
Mhm.
protein that they need. So what are some of the benefits that could be, like, when it comes to, like, I think with myself, we can talk about insulin resistance, that you can still keep your appetite microdose, but still see some, fat loss, especially around like the midsection that happens to us women that, over 35 and our midlife, that we start that thickening process.
Exactly. Most women, as they start going through the change or getting close to the change and start going through it, uh, they start to have slight insulin resistance.
Mm-hmm.
It's sub level of diabetes. So it like floats under the radar, but it's still apparent. Like when you do your blood work, it shows, oh, well, your fasting glucose is slightly up, right?
Right.
Even if on points. What you have to consider is that anytime that you're not accepting insulin in the cells like it's supposed to, your sugar can't get into the cell. Okay, I didn't explain that, but sugar has to transport through insulin to get into the cell. So if
Okay.
insulin's not getting attached to the cell, the sugar can't get into the cell. Okay, and the cell needs sugar for fuel, right? That's why that's how. So your cells are going to work less effective. So like if you're lifting weights, you're trying to work out,
Mm-hmm.
see as much of a muscle recovery because you can't get that fuel in there to recover the muscle, right? For the
Right.
fuel. So that being said, when you take a small dose of semaglutide and you're not suppressing your appetite, you're
Mm-hmm.
still getting benefits of lowering your, fasting glucose. And instead of that glucose circulating in the bloodstream and getting deposited into fat, now what's happening is that sugar goes into the cell like it's supposed to. Well, now if you're exercising that cell, it needs more fuel, right? You've
Mm-hmm.
activated more fuel. So if you're not increasing the amount of calories you're taking in, your body has to find calories. Well, what it
Right.
does is that stored fat, typically around the midsection, starts to dwindle away because it's needed. So instead of it being stored for later because you've always had this little surplus, well, now
Right.
it's like now you're in a deficit, even though the food that you've taken in has not changed at all, right? So
Mm-hmm.
it's all simple math, but you have to understand how your body works.
Mm-hmm.
Um, it kind of wants me to kind of lead off, and there's probably another question in the thing, but
Right.
talking about the loss,
Oh
right? That's
yeah.
one of if you take semaglutide, it's going to prioritize muscle loss over fat loss. That is totally inaccurate. Your body doesn't care that you're taking this medication. Your calorie intake is what determines how much muscle you're going to keep or lose or fat you're going to keep or lose.
Mm-hmm.
Okay. Your body's a very efficient machine. It wants to put off the most benefit with the least amount of work.
Mm-hmm.
So if you're not doing weight resistance training to where your body says, hey, I need X amount of muscle, then what happens is your body's like, you know what? We're not working this muscle out. I don't need it. I'm not going to keep it because it's
Mm-hmm.
costing more to maintain that. So instead of maintaining this, I'd rather burn this and save my fat for later because your body wants to survive long periods of time without food, right?
Mm-hmm.
It's survival mode like all the time. So as long as you're doing weight resistance training and you're telling your body, I need X amount of muscle, your muscle's going to stay there.
Mm-hmm.
Okay. A caveat to that would be hormone deficiencies.
Mm-hmm.
Your muscle is not going to stay there if you have hormone deficiencies because that's part of the driver in maintaining muscle for men and women, right? The
Right.
testosterone has to be there in order for you to maintain that muscle. Again,
Mm-hmm.
that's something else we're going to talk about.
Right.
But debunk the losing muscle with semaglutide, absolutely inaccurate, 100%.
Well, so since we're already here, let's just go into that about optimizing your hormones, how important that is to include that with this to make sure women are optimizing their hormones. They're just, I mean, that's another tool. Like I said at the beginning, that GLP-1 is a tool. We need lots of different tools in our toolboxes to really help get results that these women are looking for. So how can that also benefit to be another tool that they can add to this?
So when you go through the change, or even perimenopause, when you're going through the change and your body is
Mhm.
going through and downs, once you hit the change, once your body has released its last egg and you are now, boom, no longer having periods in menopause, okay,
Mhm.
your body does, it quits producing progesterone and estrogen. It's just,
Mhm.
they go, okay. So your sleep tends to be crappy. You notice that your brain doesn't want to shut down when you go to sleep, or you wake
Mhm.
up with a
Mhm.
internal brain at 3 in the
Right.
morning, can't go back to sleep. Um, or, you feel a little apathetic or just kind of like numb to the world.
Mhm.
Okay. Um, that happens when your estrogen's low. Okay. And the third thing is your testosterone. Your testosterone isn't affected as much by the change, but it still decreases. Okay. So as your testosterone decreases, you'll still see some testosterone. Most women, menopausal, it's like maybe 10 or 15 on their total testosterone. it's still low. All right. And
Mhm.
testosterone is responsible for your motivation, your drive to do daily activities. When your testosterone drops, you typically procrastinate more. Like you
Right.
put things off that are simple because you just mentally you don't want to do it. Right.
Right.
Um, your libido, it's a big thing. That's part of your testosterone.
Mhm.
But you have to have those balanced. All three of those need to be balanced in order for you to feel good, right?
Right.
If you're balanced on those, when your estrogen's low, your joints are going to start to ache because you're going to have less synovial fluid in your joints.
Mm.
And then you're also going to have less bone density because your
Right.
bones are constantly, you're pulling calcium from your bone every day. You're breaking your bone down and filling the blood with that calcium. And then your body has to put new calcium in place of that old calcium that was removed. Estrogen's a big driver in that. That's right. If
Mhm.
you're not, if your estrogen's low, you're not going to be putting on as much bone as you're taking away. That leads to thinning of the bones. That's what causes osteoporosis.
Right.
Okay. So it's important for you to have your estrogen back up to normal
Mhm.
and do weight resistance training because, again, your body's lazy. Your body doesn't want to carry around thick bones for no reason, right?
Right.
If you're not
Right.
weight telling your body you need this amount of density,
Right.
it's like I can weigh a lot less if I take a lot of this weight out of this bone. I'm not needing it, I'm not using it, and I'm going to be more efficient at what I do. But
Mhm.
you're likely to have a fracture if you fall. So,
Right.
yeah, the biggest part of hormone replacement is like it's vital that your hormones are where they need to be. And if you're perimenopausal, say you're kind of all over the place, you're not really sure where you're at, we
Mhm.
need to do we need to correlate those labs with your symptoms so we can determine do you need to go ahead and add in testosterone, even though your estrogen and progesterone are still okay. There's
Mhm.
things we do to make sure we keep your levels up until you go through the change, and then we can start managing all your hormones at once.
Right. And that's where I found through working with, thousands of women that, and with their hormones, that a lot of the doctors, they're really scared with women. They don't think women needs testosterone. And I know with myself, when my testosterone was low, like even the way I felt about myself, and you don't get the same gains. Also, the muscle growth too, and it's my bones ache. I would have aches. My body ached. And but a lot of these doctors don't look at women that they need testosterone, which we have all three for a reason. You know.
Just like a lot of men will be put on an anti-estrogen right as soon as they start testosterone replacement.
Right.
And what will happen is they'll be complaining of joint pain. Well, I'll check their labs and their estrogen's not detectable. We
Mm,
need estrogen just like women
right.
need testosterone.
Mhm.
Estrogen make us feminine, and testosterone's not going to make you masculine unless you
Right.
take too much, or if I take too much estrogen, right? We need
Right.
that balance. I think that's a very valid point is that um, a lot of doctors look at those normal reference ranges and
Hmm.
those standard to them. Either they
Hmm.
don't know about the hormones to be able to make intelligent decisions, or they don't care. That's the only thing I can think of, right? Because
Right.
practice, I can tell you those numbers are just a guide, right?
Hmm.
My patients come first. If you come to me and you're telling me you're having these issues, I don't look at your lab numbers and say, you know what, you're totally fine. You
Hmm.
can't have wrong with you because look at these numbers. They're perfect,
Hmm.
right? Because I'm going to say, well, these numbers don't reflect how you feel. So
Right.
obviously these are not good for you, right?
Right.
So yeah, you're not going to be masculine if you take testosterone. That's one of the big things, people
Right.
worry about. Just briefly, I want to touch on the cancer aspect.
Okay.
We were getting a huge, every patient that asked me, is this going to cause cancer? It's
Hmm.
not going to, okay? Just hands down, it will not cause cancer. And it's not going to be any more likely for you to get cancer than if you were doing a normal cycle, like your monthly cycle that you would have before you started your menopause, because your estrogen gets above 200 every month for you to ovulate. The
Hmm.
estrogen put you at is around 100 to 150.
Hmm.
Okay. Below what you're naturally normally going to be at. Okay.
Right.
The whole thing about estrogen is that estrogen is a fuel for certain types of cancer.
Hmm.
So if you have cancer, it could make that cancer grow faster. But again, that's
Right.
why we monitor you, right? We
Hmm.
do your ups actually more often than if you weren't doing hormone replacement. So we're going to catch it early on
Right.
But again, you can cause it. You already had it if you have it.
Mhm. Right.
Uh,
And actually you have to look at too of all that these hormones actually optimizing your hormones. And that's the one thing doctors aren't looking at, like to be for people to be actually in optimal health. You
mhm.
know, I don't want to be normal compared, because I know what normal is, what they're comparing that to. So we want to be optimal. So they're looking at more the optimal, they're not looking at the optimal numbers of what that should be, like what you said, in a therapeutic dosage, because they don't know how to dosage in a therapeutic way. So I think
Right.
that's really important for people. If you're on here and you've done HRT and you're like, I didn't feel anything different, your doctor probably didn't, wasn't using maybe the right type, or they weren't actually doing it in that therapeutic dosage, which is super important with that too. I know personally, I've been doing hormones for a really long time, during perimenopause, and I wasn't given the right dosage either until I got with someone who actually knew how to do therapeutic. And then that was the game changer for me. Okay, so let's see here. We talked about the muscle, all that, and then okay, so the one thing that I saw that was asked a few times is this medicine, is this now like the peptide they're looking at, like the GLP-1, is this taking away from diabetics?
No, it's not.
Okay.
Okay. Um, Now, commercially, you don't have diabetics going to compounding pharmacies, right?
Right.
Like if you go to a normal physician, primary care, they're going to try to offer you commercial semaglutide, which is Ozempic, Wegovy, or the tirzepatide, which is Mounjaro or Zepbound.
Mm-hmm.
Um, I don't know of any. Well, for one, insurance companies don't cover compounding pharmacies most of the time,
Mm-hmm.
right? We get all of ours from compounding pharmacies. We don't use commercial pharmacies because their prices are through the roof, right?
Right.
Because they're all brand names. There are no generics commercially
Mm-hmm.
available because they're still
Right.
under patent. So
Yeah.
no, they do. It's not taken away from diabetics.
Right. So you're using, and when we, in this program, it is a compounded peptide. So it is coming from a compound pharmacy, not your regular pharmacy, where you can talk about too. So one of the other things we can go into talking about the dosage and how so many people have all these side effects, and it's from that dosage. And the reason why is talking about that, the Ozempic and when you go there, it's coming in already a pin that's a pre-filled, what's already has set dosage. So you want to talk about that, is why the dosage is too high for most people, and they're not being able to get based upon what their goals are, based upon their body and everything too with that dosage.
Yes, this medication, it's very individualized. Okay.
Mhm.
The commercial pharmacies only make like double doses. So it's like 0.25 to zero point 0.5 to point or 1.0 to 2.0. So
Mhm.
you're literally every time you need to go up in your dose, you have to double it, which if anybody's done the compounded pharmacy already know,
Oh
you know,
yeah.
going units to 20 units, then going from 20 units to 40 units, it's probably going to cause you to have some issues,
Mhm.
right? Nausea,
Right.
the upper stomach, constipation, heartburn. Those are typically signs that you've got too much of the medication in your system.
Mhm.
That's why, for me, all these other med spas, they do like a cookie cutter. I don't know. It's like they all copy and paste the same dosing protocol, right?
Right.
It's like you take X amount for 4 weeks and then you're going to increase it, you're doubling it, and then do that for 4 weeks, and then you're increasing it. I can tell you, I've got over probably 300 patients that are on the semaglutide currently, and they dose themselves based on their body, right? So
Right.
everybody starts in units if you're doing it for weight loss. If you're doing it to microdose, you can start at 5 and go up by 5 units. But if you're doing it for weight loss, you typically start at 10. And if you get the appetite suppression at that dose, you can stay at 10 units. I've actually had a couple patients that they don't need to go up. So that literally 10
Mhm.
unit dose, a vial of a 2 ml vials last them 20 weeks.
Right.
And, they lost 60 pounds in 7 months. And,
Right.
you know, she had 115 to lose total. And
Right.
within a year now, she's lost her weight. Now she's on maintenance, but she was
Right.
morbidly obese, right?
Right.
So again,
Well, yeah,
that's the big.
exactly.
It's very dose dependent. So if she would have took like the 0.25 and then jumped to 0.5, she probably wouldn't have made it through the program because it would have any side effects and she would have thought that the medication didn't work for her.
Right. Oh yeah. Well, I just know with myself, I'm on a very low dosage and I see results, but not even myself. I have had clients that we've worked with together for this last year who have been on very low dosage. And they're like, I just met with one yesterday and she's lost so much body fat. She's not in any of the same clothes or any of that. And it's been on a very low microdose and she's getting results every week. We just keep seeing more and more. But that's where I love you and I working together with this with people, because then we can monitor how they're feeling and know how to actually, do the right dosage for them. Whether, hey, I'm feeling nauseated. All right, we need to kind of go back on that dose, like take it back a little bit. Let's start back. And that's where I think like that's why I love working together with that and with people, along with like making sure they're getting enough caloric intake, that part, making sure they're making lifestyle changes, like all that comes into play, and that's where I think the med spas and all these weight loss clinics, that's where they're missing out. It's just a cookie cutter plan. I've never been a cookie cutter coach. And I know you're not that way either with any of this, with you and I working together, even with my health. And so that's why I think it's like super important to have that understanding. That's why this program and coming together is because it's very personalized for you to get those results. And let's say maybe you do have like some binging problems, or you really, maybe that's a problem. Maybe you do, are eating in a high surplus, that maybe you do, like your dosage might be different than from mine, or one of my other clients, or one of your patients. So that would make a big difference too. And that's where you can start off based upon what the person's goals are and giving them where they should start on that dosage and how to increase.
Absolutely. Very personalized, right? Like whenever I talk to let them know, I explain to them, and, I give everybody my personal cell, right? So you get direct to me 24/7 pretty much, right? Like
Right.
you go through anybody else, you come straight to me. So when you have a question, you just text me and then I can
Right.
typically get back in like 15 minutes. And, I get asked a lot, and I think this is probably one of the questions that people ask is about the weight loss. Will it go back, right? Like if you
Oh
stop
yeah.
are you going to regain all this weight? The answer is depending on your lifestyle. Okay. Like anything else, a calorie is not just a calorie, right? Like, 200 calories of Doritos is not
Right.
going to be 200 cake or whatever, right? So, like
Right.
your lifestyle, you have to understand that our body needs good fuel to run. And if you've maintained muscle, like if you've been coached through all this, your weight loss has been well monitored, and you're not just losing all the weight because you just take in less calories, but you're still the calories you take in are crap, right?
Right.
Like not exercising, so you are losing muscle, you're losing fat, but you're losing muscle. Then when you back to eating more, when you stop the semaglutide, then you're going to put on fat faster because you've lost. And muscle, like I said, your body requires so much energy to maintain that muscle. So as
Right.
you lose muscle, your resting metabolism drops. So then as you intake, you're going to put more of that in storage because you're not burning it, utilizing that, like trying to keep that muscle up.
Right.
So changing, making sure you're staying on top of your exercising, and trying to make healthy choices with your food, you can absolutely maintain the weight loss, right?
Right.
But no, not just you do this and boom, you're done, and now you've lost the weight and you can eat whatever you want the rest of your life, right?
Right.
That's
Right.
right. If you're overweight, you got there from food, right? And the combination of probably lack of energy expenditure, right?
Right.
Exercise.
Right.
It's just a change in your brain to realize, you know what, I don't want to be this way,
Right.
right?
Right.
And that's why I like working with you, is because I know about nutrition, I know about personal training and things like that, but I can't
Right.
have so much medical I have to take care of with my patients that I can't do the personalized workout plans and stuff. I just don't have enough hours in the day. So
Right.
having you be on top of that with them, it's absolutely, we'll have the best results of anybody, just because, you need
Right.
that nutrition guidance in your exercise.
Right. Yeah. Just a bunch of, and I appreciate that. Yeah, it's a bunch of tools we're just putting back. It's like I've always described women is that we are, women, we're very complex. We have lots of puzzle pieces, a lot more than men. And we just have to put it all back together. And it can be done through, and obviously these are definitely tools that we use, and using a GLP-1, optimizing your hormones, it does give you a leg up. And I think that's, important. Like sometimes we feel like we're struggling, especially in midlife, there's a lot of stuff going on. So to have this little leg up, I think is very beneficial. Let me see, I think, and then let's touch on one and then we can end it there. But talking about this, using this, you touched a little bit on it, about if it's not these people, if you're not coming on here for weight loss and you've heard about microdosing and GLP-1s for longevity, for inflammation, can you just touch on that a little bit?
So yeah, the decreasing of the cytokines, which is a response of the GLP-1, the cytokines for a response, lowers inflammation throughout your body, right? So that's key for anything. You need to lower the amount of inflammation that your body has, because inflammation, it's good for an injury, right? You need the inflammation to heal, recover injuries, but unnecessary inflammation causes issues, right? So removing that extra unneeded inflammation, not because you're trying to heal a cut in your arm, right?
Right.
On your in your intestines or wherever it be, your skin, dermatitis, removing those, it's vital for overall health. So that aspect of it, of the anti-inflammatory response, is great long term. Clarity aspect of it, right? To where making sure you're neuroprotective, you're not putting on plaque in the neurons in the brain, right? To keep you sharp. And then every woman that goes through menopause, 99% of the time, they start seeing that insulin sensitivity drop. That insulin sensitivity, when it drops, you may not be taking in more calories, but you're going to start depositing more fat. It's just going to, and that's why people say, well, I've got this stubborn area, I'm eating healthy, I'm doing all the things I'm supposed to do. And they are. I don't doubt that, right?
But
what
that was me.
exactly what they're not doing is, it doesn't matter how much you exercise, it doesn't matter what you eat. If you have that insulin sensitivity issue where you're resistant to some insulin, you are going to fat, right? It's just going to happen because your sugar cannot get into the cell where it's needed. So you'll notice increased fatigue, decrease in the ability to maintain and build muscle, and deposited fat around the abdomen is typically where we end up putting it, lower abs. Doing that microdosing, it doesn't have to be enough to where it suppresses your appetite, so you're still eating just as much. Now, it might help calm some of those cravings that you might have, like you don't have to eat a lot, or you don't have to eat too much to have those cravings come at you where you're like, something sweet or salty or whatever your kind of fix is. You can avoid it, right? Like, I know I'm eating a healthy meal, I've got my regimen, I'm strict on it, but it still kind of is in the back of your mind that, man, it would be so nice to have this, right? So that semaglutide does help kind of quiet that noise down to where it's like, it's not as significant to you to not eat your favorite chocolate or whatever your bad habit is. And it makes it a lot easier to take in your calories that are healthy, because eat less out of hunger, need for food, as you do just planned out. I have this I want to eat, right? Because I have my goals. So
I was even say, I've noticed that some of my clients have said too, like that were big wine drinkers. At night, they always just wanted the wine, and they're like, I have no desire for the wine. I will say today, so my daughter's boyfriend delivered like my favorite like donuts, and that would be like my thing that I would be like, oh my gosh, I have to have that donut. And not that I deprived myself, because if I wanted the donut, I'll eat the donut. But it was like funny because I was like, I don't even want the donut. And I was like, that's weird. That's the first time I ever noticed. I'm like, I didn't even want the donut.
Absolutely. And it makes a difference because it takes the disappointment out of it, right? Like, yes, I've dieted plenty of times. I know how to diet, what I need to do. But when I diet, it kind of stinks. You don't want to feel hunger, right? So it takes away that, like, that need or craving, and it's like, wow, they could put your favorite dessert in front of your face, and you're just like, I'm okay. Like I don't need to eat that. Like I don't have any desire to eat that. And then
Right.
you can eat a salad or a piece of steak or whatever, just fine. But
Yep.
it,
That's exactly what I did.
so yeah, people will worry about that all the time. I get asked that, is this going to make me lose weight? I don't want to do this if I'm going to lose weight. No, it depends on your dose. If you take enough of it, yes, you'll lose your appetite and you won't eat as much. You'll get
Hmm.
full fat. But if you just do the microdosing and you just dose up to where you feel good,
Hmm.
you're not going to lose any weight. You're not, well, I say you're not going to lose any weight. You're not going to take in any less calories, right? You
Right.
might still weight loss because if you're putting on muscle and burning fat, if you burn fat faster than the muscle's going on, you will see
Hmm.
some. Typically, you just notice kind of a flat line though, because muscle weighs more.
Right.
So
You lose the
now,
inches. Yeah.
exactly, you lose size,
Right.
circumference, but your weight still stays the same.
Yeah.
So that's
That's what I've noticed because I mean, my pants are all loose around my waist, and but it's not seeing the weight change, but I definitely saw the inflammation dropped, and then the weight, the thickening that I call it, start was definitely changed. All of a sudden, I was like, oh, because I haven't felt like I don't feel like I'm taking anything except for when those like said little things like the donuts, or I mean, I haven't had any side effect whatsoever. And the great side effect that I've had is the when my pants were feeling a little bit uncomfortable, and I was doing all the right things, and my A1C, all that started kind of going up, and so we kind of like, we're like, all right, there's something going on, but I'm doing all the right things. There's really nothing else we can change, and so this gave me that leg up, help support my body where it needed.
Yeah. And you're a perfect example because a lot of people say, well, type 2 diabetes or acquired insulin resistance is from taking in too many carbohydrates or not eating healthy.
Mm-hmm.
Absolutely. It has a lot to do with your hormones. And also genetics plays a part in that, right?
Right.
So I know your diet was good. Some patients say their diet's good and you have to take them for their word, but you don't know for sure. But with you, I knew like, hey, this
Mm-hmm.
doesn't your A1C's up, but I know you're not eating too many carbs. I know you're doing the right thing.
Mm-hmm.
So that's why I pushed for the GLP. I thought that will
Right.
help your body get the sugar where it needs to be. Because it's not that you're taking in too much, it's that what
Right.
you're taking can't get to where it needs to be.
Right. Yeah, I'm very thankful. One last really quick, and you can go on quick, is about the people were asking regarding like brain health, the brain fog, like certain things like that, how that can help. That a lot of women that are kind of like suffering from, and also being very preventative. Because one of our conversations was, I really wanted to do this because it wasn't for me, it was like the weight loss part. It was for longevity, but it was too for because my grandmother had dementia, and I do every single thing I do is for being very proactive against that because I had two grandmothers with that. So just if you want to touch really quick on that.
Yes. So I'm going to plug my phone up here
Okay.
because it looks like I'm getting a little low on my battery. Yeah. All right. So yeah, the neuroprotective is what I call it aspect of it, right?
Mhm.
Like um, ensuring that you're not doing any kind of damage to your brain by forming those plaques. And the plaque formation is big part genetics, right? Like it's not
Mhm.
like certain things that you eat that we know of, right?
Right.
Based on literature, there's not like certain things you eat or certain lifestyle you have that leads to it. It's more, from what we understand, genetics. And
Uh-huh.
up to the point, we really haven't had anything good to reverse plaque buildup in the brain. We didn't know how to target it, and this was kind of like it was a surprise. We didn't. I don't think the scientists that come up with this GLP-1 had any idea it would have that effect. But we started seeing patients say, "I feel like I'm just more focused, like
Right.
not Adderall sped up, but more like
Mhm.
Adderall focused. Like, wow, I can do something even though a conversation's going on over here. I can tune it out and I can
Right.
focus on what instead of my brain wanting to listen to what's going on over there. So again, there's not enough science behind it to be able to tell why it does what it does, but we have seen a large number of people I mean, it's very consistent across the board that they're having these improvements. And like I said, the studies going on about Alzheimer's right now, they are already showing that it is reducing the amount of plaque that has been built up in patients. So they're seeing a reversal of Alzheimer's. And again, they're probably going to continue the study for another year or
Right.
two. But as that literature comes out, we're going to see, and it'll explain more of why it's doing what it's doing. But yes, it's very neuroprotective from what we've already seen, and
I love it.
the reasons I'm going to continue doing it myself, even though I don't need any of the weight loss aspects of it.
Yeah, that's the same thing with me. Well, I think that was, I think we answered all the questions that people had, and I think that was great. I mean, I know that you had been talking to me about this, even though we were using it with clients, talking to me about this, thinking it'd be very helpful. And I was just like some of other people who are probably listening to this and heard some of the other things and we're like, I don't want to lose all the weight. I don't want to lose muscle, all that, because we work so hard for it. So I appreciate you coming on and really like debunking this, really giving the truth. I can tell I'm a testament that I finally said yes, and I wish I would have done it months and or last year longer, but you know what, it's been very beneficial for me, so I'm excited to see other women be able to put this in the right, but do it the right way, like, and use it. It is just a tool, and there's a lot of other things that we need to incorporate with it. So I'm excited and I appreciate you so much. And then too, with this recording, you'll also make sure you see the attachment. I will go over the ways that you can be able to get into this program, the information that we need. And also, Dr. John mentioned about blood work that is also included into the program too. So you'll see all of that in there. But I appreciate y'all for being on here. Thank you so much, Dr. John.
You're very welcome.
All right.
It's my
Take care. Bye.